Hello, everybody. Welcome back into Talking Fitchburg, and I am joined today by a special guest, a recurring guest, a friend of the show, maybe I'll say, Deputy Chief Jeff Dostalek over here from Fitch-Rona EMS. How are you doing today?
I am doing awesome today. Thank you very much.
Well, we're glad to have you on here. It's always a pleasure. We're always glad we can steal you away for just a little bit.
And I don't mind at all. I
Well,
like talking about our service.
well, I'm glad. I'm very glad because we have you here every month. So it'd be a real shame if you were like, ugh.
I just don't want to
Gotta go back to Talking Pittsburgh. No, it's always fun. Appreciate you coming on. And today we have a topic that kind of affects a whole bunch of people.
Sure.
A whole, range of severities, and we're talking allergies, ladies and gentlemen. That's right. I'm affected by allergies, just so you know. I complain about it on this show almost on a daily basis. So we're going to cover all kinds of things about allergies, sort of different reactions, who has them, all kinds of different stuff. So just to kind of start, how do you define an allergic reaction?
Sure. So I thought this topic would be kind of, with summertime coming, the spring is here, people start having allergies. We start getting calls for allergies, bee stings, things like that. So about 30% of the U.S. adults and 40% of the children have some sort of allergy. So whether that is hay fever or an allergic reaction to peanuts. So there is quite a bit of the population that does that. And I mean, you said you suffer from allergies
Yep.
yourself, so you know how those feel,
Oh,
especially
yeah.
this time of year. So some of the common causes would be, just for a regular allergic reaction, nothing that's very severe.
hmm
You could have pollen, bee stings. If you have mold in your house or your place of employment, that could cause allergies as well. Some people are allergic to insect bites, things like that.
hmm
The major ones: bees, peanut allergies, latex, and shellfish are the big ones that people
Okay.
are allergic to as well.
Sure. And then, so what sort of, you talked about, some more severe reactions. What are kind of the different reactions that people might have to an allergy?
Sure. So, kind of the mild reactions would be reddening of the skin. If you got
hmm
bit, you might have some swelling or something to an area. People have mild shortness of breath. Their sinuses clog up. So, if you have especially if the pollen, so I have hay fever bad. So, in that season, my sinuses clog up.
hmm
Sometimes it gets a little bit hard to breathe. And then there's also a GI component of it. So, people have an upset stomach. They sometimes vomit or have diarrhea. Those are kind of the mild reactions to it.
Sure. And then on the flip side of that, if someone is going to have more of a severe reaction, what could that look like?
Sure. So we would call that an anaphylactic reaction. So severe reaction, throat swelling, you feel like your tongue is swelling, extreme shortness of breath. You would have chest pain, wheezing, stridor, hard to talk. Vomiting, diarrhea are also big components of that.
Sure. So if we're dealing with a anaphylaxis or anaphylactic reaction, how are we going to treat that? How are we going to deal with that as just a civilian, a person who might have that happen?
Sure. So for a mild reaction, just if you have Benadryl, over-the-counter Benadryl seems to work most of the
Sure.
time. But if you go into the anaphylaxis and you have those symptoms that we just talked about, then an EpiPen is probably going to be the treatment of choice. So if you're not prescribed that, obviously, if you have those symptoms, that would be a good time to call 911
Okay.
and have us, come. There's certain drugs that we can give, epinephrine being the main one. And then Benadryl as well also helps with those. So Benadryl is an antihistamine. It takes that histamine reaction away from the body.
Sure. And then just a question here for you. If maybe you see a kid or someone younger and you see them having a reaction, at what point in your mind do you kind of think it's time to go ahead and call 911? Or, if someone that's not maybe you is being affected, when do you know it's time to reach out for help on that?
Sure. So I would guess, somebody that if there's a child that's having extreme shortness of breath, we'll see urticaria or hives systemically. That's a time to call 911. If they feel like their throat is closing up or they're having, their tongue is swelling,
Sure.
those are times that you should call 911. Most kids, if they're not aware that they have an allergic reaction, it could be pretty severe. It never hurts to call,
hmm
and if there's a parent around, we can have a conversation with the parent. But if you're unsure, call 911. We can take the child to the hospital and at least get them checked out for sure.
Absolutely. And then just sort of other recommendations, I suppose. If you have someone who has severe allergies, you have those EpiPens, you should carry them with you everywhere, sort of
Yes.
just make sure that you have access to that at any point in time that you might need it, especially when we're out now with, like you said, bees. You got all kinds of stuff, all kinds of extra risks with the kids out there this summer.
Yeah, I would, EpiPens, that we know that they're expensive. It's been in the news on how expensive the
Hmm.
EpiPens are. But I would carry one in your purse, carry one on your person, carry one in your car if you can afford to do that. Have it close, especially if you're going to be outside. For those people that have allergies to, latex or peanuts, you don't know that you might come in contact with somebody in the store and they had gloves on for some reason, or they had latex. Always have that handy for you. That's your lifesaver.
Great. Good tips, good things to keep in mind, to think of. Always good to get a little reminder out there. Make sure you proceed with caution, ladies and gentlemen. Still enjoy yourselves, but make sure you got any medications you might need. Remember 911 if things progress to a serious situation. And yeah, let's try and have a allergy symptom-free summer out there. How
It's
about it?
probably not going to happen, but it's a good goal to have.
It's a great goal. It's a great goal. Jeff Dostalek, appreciate you very much for coming on, and we'll get you back next month talking about some more important health topics here on Talking Fitchburg. Let's take a quick break.